Hello, my name is Haley Fringe, and my presentation is over dislocated shoulders. The shoulder joint, also known as the glenohumeral joint, is a ball and socket type joint. It is the body's most movable joint. The shoulder joint allows for a wide range of motion and can move in a variety of directions. The joint is held together by the rotator cuff muscles and a joint capsule. Even though this joint is extremely flexible, these movements make it more susceptible to injuries such as a dislocated shoulder. These injuries can cause pain and unsteadiness in the shoulder. A dislocated shoulder is the result of the humeral head being forced out of its position in the socket of the shoulder joint. A shoulder can dislocate either partially or completely. A partial dislocation consists of little movement of the humeral head, whereas a complete dislocation consists of total movement out of the socket. A shoulder can also dislocate in multiple directions. An anterior dislocation makes up over 90% of dislocated shoulders. This is likely caused by a fall on an outstretched arm. A posterior dislocation accounts for only 2 to 4% of dislocations, and this can be the result of a hit during an athletic event. This injury is extremely common due to the anatomy of the shoulder. A dislocated shoulder can happen to anyone, but it commonly occurs in young men due to physical activities and contact sports that raise their risk. A blow to the shoulder or a fall is the most common cause of a first-time shoulder dislocation. It will most likely dislocate anteriorly also. Sports such as hockey, football, gymnastics, and downhill skiing increase the risk for a shoulder dislocation. Shoulder dislocations are also common complications after car accidents, epileptic seizures, and strokes. So, a dislocated shoulder can happen outside of sports. Common symptoms for a dislocated shoulder include deformity, swelling, numbness, weakness, and bruising. People also describe a popping or a rolling out of place sensation after dislocating their shoulder. When looking at the shoulder's asymmetry can be noticed. Pain often occurs immediately after the dislocation. Muscle spasms are common after a dislocated shoulder, and this can add to the pain and make it harder to put the humeral head back into place. Another symptom could be little or no movement of the shoulder. Numbness can also be felt throughout the arm, hand, neck, and/or fingers. Bruising and swelling can also occur after a dislocation. Diagnosing starts with symptoms such as feeling like the shoulder is slipping out of place. A physical examination will help to determine whether or not the shoulder is loose or unstable. A physical examination can consist of palpation, observation, and range of motion and strengthening test. Based on what the medical professional sees during a physical examination, he or she may then order for medical imaging, such as an X-ray. And imaging such as an X-ray can help to show damage done to bones, cartilage, and/or the rotator cuff. For treatment, a doctor will place the ball of the humerus back into the joint socket, which is known as a closed reduction. As soon as this is done, the pain should immediately go away. Afterwards, the shoulder should be put in a sling for about 1 to 3 weeks. This will help to prevent the shoulder from moving, which will help it to heal. A person may also begin physical therapy to help the shoulder heal and to help prevent future dislocations. Surgery may also become an option after a shoulder dislocation. This will likely take place 6 months after a dislocation if the patient is still experiencing symptoms such as instability, stiffness, or pain. There are several surgeries a surgeon can choose from to fix a dislocated shoulder. One such surgery is called a Bankert repair. This surgery is used mostly for anterior dislocations, and it's used to repair the labrum and re-anchor it to the shoulder socket. If a person has experienced many shoulder dislocations, a capsular shift surgery may take place. Surgery has been known to prevent other shoulder dislocations from happening. Recovery after surgery highly depends on the surgery that was performed and how the surgeon goes about the surgery. Most people will be put in a sling after a shoulder surgery. For rehabilitation after a shoulder injury, like I've already said, a doctor may immobilize the shoulder in a sling or other device for several weeks. Plenty of rest, icing sore areas, and doing exercises to restore range of motion and to strengthen the muscles are also recommended. Prevention can greatly reduce the risk for a dislocated shoulder injury. Rotator cuff and shoulder blade exercises are excellent at preventing dislocations. Simple exercises such as a push-up or bent over rows can also help with prevention. Exercises that challenge stability of the joint are also successful in preventing shoulder dislocations. Also, while the patient is seeing the physical therapist after their surgery, the physical therapist can give them exercises that will help heal from the surgery, but they can also give them exercises to work on after they've healed to help prevent future dislocations from happening. So in conclusion, the shoulder joint is highly susceptible to shoulder dislocations due to its poor anatomy. It is a common injury, especially for young men. Shoulder dislocation can be caused by a blow to the shoulder or a fall. To repair a shoulder dislocation, a doctor will place the ball of the socket back into the shoulder joint, which may require surgery. Rehabilitation after an injury like this could take several weeks, and prevention is key in avoiding more shoulder dislocations.